My Lords, the soft drinks industry levy and location promotions legislation, together with the voluntary reformulation programme, have resulted in businesses lowering the levels of sugar and calories in a wide range of products. Pending regulations on volume, price promotions and advertising should encourage further reformulation of less healthy products consumed by children and their families.
My Lords, as the Noble Lord is aware, I've been pressing the government to reformulate, removing sugar and using alternatives which are healthy instead of sugar. Yet the government is unwilling to do that. Yet it's prepared to spend £40 million now on running an experiment with the anti-obesity drug Wegovy. Could you tell me, please, why they could spend that money in that area, yet not spend it on exploring the possibilities of using alternatives to sugar? And could he say whether children will be part of the experiment, of the anti-obesity experiment that's taking place, and if it is successful and developed further, will they be giving children anti-obesity drugs?
Well, I'm grateful to the Noble Lord for the question. I pay tribute to the work that he does in this field, and indeed to a lifelong service as a trade union movement and the community of service volunteers. The government is tackling child abuse seriously, and that we will continue to work closely with industry to make it easier for people to make healthy choices. It remains up to businesses to decide if and how they wish to use sweeteners, including stevia, in food and drink, and which ones to use. Indeed, we know that some businesses are already using stevia and the like in the products they make. However, sweeteners are not permitted in all foods, and some consumers do not want sweeteners in the products that they buy. Businesses can and have reduced levels of sugar in foods without the use of sweeteners. And in terms of the specific question about using children, I cannot give him the exact answer from this dispatch box, so I will write to him.
Would the Minister kindly explain why... Can the Minister kindly explain why the government doesn't adopt the technique of the Canadian government? The children of Canada have been fed on whole milk for many years, thousands and thousands of children. They're much healthier and they're not obese. And furthermore, could the government encourage the 40 million obese people in this country to eat the right kind of fat, because that tends to limit obesity?
So the Noble Lord is a doughty campaigner on this subject, both in this House and within the department. The government recognises that milk and dairy products make a valuable contribution to a healthy, balanced diet as a source of calcium, protein and vitamins and minerals. However, they are also a source of saturated fat, and so government advice is to choose lower fat milks and dairy products where possible. Full fat milk and dairy products are recommended up to the age of 2 years, after which lower fat versions, such as semi-skim milk, can be introduced, provided that the child is consuming a varied diet and is growing appropriately for their age.
My Lords, I must declare an interest as a governor of the Weizmann Institute of Science in Israel. Is the Noble Lord the Minister aware of the sugar-reduced food solutions being produced and marketed by the Weizmann Institute? If not, would he research it and please put a letter in the library advising Noble Lords of the advances being made? And could he say if similar research and solutions to reduce sugar in food and drink are being undertaken in the UK academies?
I presume the Noble Lord is referring to a product called Incredo sugar, which provides the taste of sugar while reducing the amount consumed by between 30 and 50%. I understand that during the processing, a molecule is added to natural cane and beef sugar that moves more sugar into a person's saliva, causing a heightened taste of sugar. To date, the product works best in solid foods like chocolate and baked goods. We are not aware of any similar research being undertaken within the UK academia or indeed industry.
My Lords.
The risk of obesity is greater in those who suffer food insecurity, costing the National Health Service £6 billion annually and unlikely to rise. It's reliably estimated, meanwhile, that £1.70 is returned for every £1 invested in free school meals over a 10-year period. Would the Minister not agree that free school meals for all primary and secondary school children would be a sound investment?
I'm not sure I can make that commitment to the noble lady. The school's full standards ensure children have healthy food and drink options across the school day, and they restrict foods high in fat, sugar and salt, including high sugar foods and confectionery. The Department of Education continues to keep the SFS under review. It is right and proper that those families that cannot afford school meals should be helped by the taxpayer, but we cannot commit to providing for all school children.
My Lords, the data is devastating. 11-year-olds in the poorest areas of our country are twice as likely to become obese as those in the wealthiest, and that gap is growing. Can I ask the Noble Lord the Minister to take a brief holiday from painting a rosy picture of the government's plans, as I know it's his job to do, and acknowledge just how badly we are failing children in poor areas who are acquiring conditions that will leave them less healthy than their wealthier neighbours for the rest of their lives. This requires big, bold steps and urgency, something which the government can show in other areas of policy, but not here where it really matters.
I'm not aware, to the noble lord, that I am painting a rosy peach picture. There is serious issues with childhood obesity in this country, as there are indeed in other countries around the world. Nearly 1 in 10 children, 9.2%, start primary school living with obesity, and approaching 1 in 5 children, 22%, leaving primary school living with obesity. Children living in the most deprived areas are more than twice as likely to be living with obesity than those living in the least deprived area. And obesity costs the country an estimated $58 billion. The government is doing all that it can to help reduce that from an early age.
My Lords, given the Noble Lord the Minister's response just now, does he acknowledge that the government's childhood obesity plan has presented us with what NHS England now describes as a ticking health time bomb? And what assessment has the government made of the impact of its own flagship sugar reduction programme, only managing a 3.5% reduction and failing to meet its 20% target?
Well, I'm grateful to the noble lady, and she again raises a very important subject. It is not unique to the United Kingdom. Many countries in the Western world has this issue with childhood obesity. Sugar intakes in children aged 1 to 18 in the UK are double the recommended maximum level, and more than 5% daily energy intake. Consuming too much sugar can lead to weight gain, which in turn increases the risk of serious diseases such as cancer, heart disease, type 2 diabetes and COVID-19. It also increases the risk of tooth decay. Modelling shows that children who are overweight or living with obesity consume between 140 and 500 excess calories a day, depending on the age and gender. The government is working hard and doing a huge amount to reduce childhood obesity, but there's clearly a lot more to be done.
My Lord, can I ask the government what they are doing to challenge the... My Lords,
I think we should hear from the crossbenchers and then my noble friend and then the green benches.
Government, what it's doing to challenge the industry about the types of substitutes they use for sugar. The big ones like aspartame, when they go into products like Diet Coke, in fact create the illusion in your brain that you've had something sweet, whereas your stomach is telling you you've had nothing. They are in fact now on many scientific levels being seen to not make any difference to obesity. Dietary is true of low-fat yogurts. In fact, they can help to contribute it. So how is the government tackling the industry to understand whether these low-fat products are actually helping with diets? Because I believe they're not.
Well, I completely agree with the noble lady. Aspartame is an issue in diet food such as yogurts and drink, and we work very closely with the industry to try and look at formulations that can help with reduced sugar, and there has been a lot of progress made. But one thing I would say, I remember as a child, when asked by my grandmother for what would I like, I used to say fizzy drinks, and she used to provide me with something called Corporation Pop, otherwise known as tap water.
My Lords, as my noble friend the Minister will know, obesity rates are the highest in deprived areas, followed by higher incidence of mortality and morbidity related to type 2 diabetes, heart disease and strokes. And there is a high level of prevalence of food banks also in these areas. can my noble friend the Minister say if there is any correlation between the instance of deprivation, poverty and food banks? And I did think my noble friend Baroness Bycott made a very interesting suggestion at question 2. How are the government addressing these issues?
This is a complicated picture, as there are many factors that contribute to obesity. We know that there are more fast food outlets in deprived areas offering very large portions of calorie-dense, nutrient-poor food. Buying this type of food can be seen as value for money for people who are struggling financially. We also know that people living in an area of high deprivation are subject to more advertising, thus encouraging purchasing of foods higher in fat, salt and sugar. Food banks offer emergency food provision, and people may be accessing these as a short-term measure, and they may not represent the food that is routinely consumed over a long period. The government is working hard with industry. The reduction of sugar is going on in the reformulation of many, many products that we all consume, but there's clearly a lot more to be done.